Good morning, everyone. My name is Deirdre Mills, and I'm the chair of the Confederation of Service Charities Female Veteran Cluster. I would like to welcome you all to the launch of the We Also Served report into the health and well-being of female veterans in the UK. I'm struck by the fact that we have well over 100 people on the call today. That's a terrific number. It's a reflection of just how important the female voice has become, as well as an indication of just how much the government and the military charity sector want to now engage and play their part. We have a truly remarkable lineup of speakers today, an in-depth look at the report findings by Anglia Ruskin University, a perspective by NHS England and NHS Improvement, an update from the new director of the Office of Veterans Affairs, reflections by the Ministry of Defence, and a panel question and answer session to follow. Before we launch, however, it is perhaps worth thinking about how we got to this point. And although women have served for decades and in multiple theatres, it took a lone and very brave voice from the WRAC Association to stand up at the Confederation's AGM in 2019 and ask the question, what are we doing about female veteran issues? And I say brave because in challenging the status quo, she has asked us to examine our contribution towards it. She has queried a system which many of us have worked hard to perpetuate and from which we have derived considerable benefit. And the question itself caused consternation. What were the issues we needed to be thinking about? And should women veterans be acknowledged and treated differently from their male counterparts? And although many of us would feel intuitively that something needed to be done, we didn't have the evidence and we simply didn't know. And so we convened a female veterans cluster to sit separately to the clusters that focus on specific issues such as employment and housing. Thinking and feeling that health and well-being would be a key subject, we sought support from NHS England and commissioned a scoping study to identify and highlight issues that are specific to female veterans, to seek improvement on current levels of support, and then to ensure that our services are appropriate, inclusive, and accessible. In doing so, can I say that we're not trying to negate the experiences, the successes, or the difficulties of other service personnel, nor does it mean that women do not experience the same things as men. Instead, this is about exploring additional pressures and helping women overcome extra challenges so that they can operate within a welcoming and accepting environment, compete from an equal starting point, and be afforded similar levels of opportunity and care. And so to the We Also Served report, a report which is quite simply groundbreaking, and it is the only comprehensive evidence base that we are able to draw upon in respect of female veterans and their health and well-being needs. There have been many singular reports over the years that have pointed to disadvantage for female personnel, and also many policy changes which have gradually improved conditions for women over time. It is therefore a complex and multi-layered picture, but there is no escaping the conclusion that women who serve and who come to us as veterans have insufficient voice. Now, however, in the We Also Served report, we have found a way to tell our story and, as the report proves, to tell those who can change things that there is still an awful lot to do. Now, before we move on to our first speaker, can I just cover some quick housekeeping points? Please use the Q&A box to ask questions for the panel discussion. Please use the chat box to network with other attendees. Please keep the use of language professional and polite. And now, without further ado, I'd like to introduce you to our first speaker, Dr. Lauren Godier-McBard. Lauren is the principal investigator of this research, and she is a senior research fellow and the Women and Equalities lead for the Veterans and Families Institute at Anglia Ruskin University. Lauren, over to you.
Thank you, Deirdre. So this is the awkward bit where I share my screen. So I'll just do that now. Okay, so I'm going to present to you the findings and recommendations of We Also Served, pulling together what we know about the health and well-being of female veterans in the UK. So this is what I'll be covering today, with some context on women in the UK Armed Forces to begin with, followed by how we conducted this project and a whistle-stop tour really of our findings and recommendations. And this will be the headlines, as I don't really have time to go through this in detail as much as I'd like to today. So I would really recommend downloading the report, which will be available for download after this, and we'll provide the link for you in the chat. So first, a bit of background on women in the armed forces in the UK. So women's integration into the UK Armed Forces has been incremental and a result of a number of policy changes over the decades. So women were first able to serve in the First World War and were allowed permanent peacetime roles after the Women's Service Act was passed in 1948. And women currently make up 11% of the UK Armed Forces, and this is a significant increase from when MOD online records began, at which point it was only around 4%. However, if we look at comparison to the proportions of women in the militaries of other countries, and I've highlighted the other Five Eyes Alliance countries here, this proportion is a little lower. They also make up 11% of the veteran population. However, this is projected to increase to 13% by 2028, with over 1,000 women leaving the armed forces every year. So the population is increasing. And there remained a number of fairly restrictive policies that led women to often leave service early historically, up until some at least up until fairly recently. And these included restrictions on marriage in service, automatic discharge for pregnancy, and the repeal of the ban on homosexuality, which of course affected men and women. Additionally, up until recently, women were not able to serve in ground close combat roles. But this ban was lifted in 2016, and by 2018, all roles were open to women. However, women's social integration into the military has been a little bit more complex, and you'll see that as I go through the findings of the report. So the project, and why did we carry out this project? Well, research with female veterans in the UK and internationally is limited. And one paper recently reported that just 2% of veteran research internationally mentions women, and an even smaller percentage actually focuses on women. And this means our understanding of female veterans' needs has been limited, as Deirdre mentioned earlier. So in recognition of this, the Cobseo Female Veteran Cluster, supported by NHS England and NHS Improvement, commissioned us to undertake this study. And the aim of this study was to outline what is and isn't known about the health and well-being of women veterans in the UK. And importantly, to provide a prioritised framework of how to take forward research and support activities with female veterans in the UK in a meaningful way. So what did we do? Well, there were three elements to the evidence gathering phase of the research, which is in blue here. The first one of these was a comprehensive scoping review following a rigorous framework. And this involves systematically searching academic and grey literature databases for papers and reports that outline primary data collection with female veterans in the UK. Now, to support the what we expected to be the limited UK evidence base, we also collected international literature from the other Five Eyes Alliance countries. And this was to look for both consistency in findings, but also gaps in the research base, rather than to directly apply this to the UK context. However, the full scoping review process was only carried out for the UK, and a more detailed kind of outline of these methods can be found in the report. In addition, we also drew upon statistics and reports from the Ministry of Defence to provide context from in-service where relevant. And to supplement the evidence base, we also interviewed 13 subject matter experts, all of whom had experience of working with or supporting female veterans in some capacity in the UK. And we had representation from across the statutory and third sector support services and organisations. And these interviews focused on their perspectives of the impact of military service on women and women's experiences following transition. We also disseminated a call for evidence through our networks of academic researchers and also veteran organisations. And this asked for previous and ongoing research on female veterans, or focused on female veterans in the UK. And this was to try and ensure that we didn't miss anything with our scoping review. And the evidence was combined from these three elements, and findings were presented at 2 stakeholder workshops with both female veterans in one and representatives from veteran organisations in another. And the purpose of these workshops was to discuss and identify priority areas for research and for support and policy activities from the perspectives of these stakeholder groups, having presented them with our findings so far. And we did a number of interactive activities with these groups in order to draw out and rank priority for recommendations in the report. And this helped us to create a framework within which we fit the recommendations that we make in the report. So moving on to what we found, well, we identified 50 research papers from the UK. And this was including both peer-reviewed papers, research reports, and PhD theses as well. And all of these were published since the year 2000, with the majority published more recently. The large majority focused on physical and mental health in female veterans and was dominated by 2 large cohort studies from the King's Centre for Military Health Research and also the Scottish Veterans Health Study. Both of which have surveyed large numbers of ex-service and some service personnel as well. Interestingly, there was quite a stark contrast between this focus on health in the literature and the issues that were highlighted by our experts and our stakeholders. Now, these discussions, in contrast to the literature, heavily focused on the challenges associated with both the impact of historic terms of service that I mentioned earlier, but also the treatment of service women in the male-dominated military culture, as well as the socioeconomic impact of these issues post-service and how they impacted women accessing veteran-specific support after military service. So I'm going to give you a walkthrough of our main findings now, looking first at what we found in terms of in-service experiences and issues, followed by health and well-being after leaving the military. And now, as I said, it's really beyond the scope of the presentation to go through these findings in detail. So I'd really recommend downloading and having a look at the report afterwards. So one of the in-service issues that emerged was the experience of female veterans reported in joining the male-dominated military environment. And most of the evidence related to this was based on qualitative reports and also our expert interviews. These give us an indication of what these samples of women experience, but more research is really needed in this area to determine if this is, representative of the veteran population as a whole. So with that in mind, there were a number of themes that came out from the evidence that we found. Women reported the importance of accepting masculine banter to fitting into the military, and others reported adopting what they perceived as male traits to fit in. And women across studies also reported feeling as though they had to work twice as hard or harder than men to prove themselves, and feeling as though they were evaluated differently just by nature of their gender. And these experiences were described as impacting poorly on their well-being. So women also reported experiencing stereotyping and discrimination related to their gender, which was sometimes again minimised as banter. but many women in these studies felt that they were treated unfairly on this basis and often didn't feel able to challenge these attitudes. Examples of this kind of discrimination or stereotyping during service was included women being asked to do things like put pictures on their CVs to improve their chances of getting roles, or in fact changing their gender on application forms. Now, some women also reported distancing themselves from other women, and this was to and also avoiding feminine traits in order to kind of avoid that discrimination that they felt was associated with female gender. And our SMEs also discussed the difficulties that women faced as a result of working within the masculine military environment, and felt that there was a high tolerance for this negative gender stereotyping and discrimination. And this is consistent with international research as well. However, what we don't know, or what we don't have in the UK, is any research that looks at the links between these experiences to well-being after service. So we don't have that connection at the moment. And now, in relation to deployment and its impact on women's health and well-being, evidence that we found suggests little differences in health incomes in comparison to their male colleagues, with both reacting similarly in terms of their psychological well-being. However, data from qualitative studies suggest that women don't always feel as though their deployment roles are recognised by society, and that they may be dealing with the same types of trauma as men as a result of deployment. And this is despite the fact that, of course, women have been in frontline support roles for many years, whilst the ban on ground close combat roles was repealed only recently. For both men and women, poor unit cohesion and poor perception of leadership on deployment was related to poorer well-being. However, the women in these studies were less likely to report high levels of unit cohesion, and highlighted a perceived lack of support from their unit in some cases, particularly in the cases where they were accommodated separately to male colleagues. They weren't with them as often. Additionally, women are underrepresented as senior leaders in the military, and qualitative research also highlighted that some service personnel were resistant to women being in leadership positions, or that women perceived that and felt that they were reluctant to work with them. And again, this is supported by the international research that we looked at, which also highlights the fact that women feel the need to adapt their leadership style to that of men, and feel as though they are evaluated more harshly than men. However, we weren't able to find any research in the UK that looked at women's experience of leadership in the military. So work-life balance was an area of focus in service that had the most evidence, I would say. And this research indicated that balancing military life with having a family can be very difficult, and is related to increased physical and mental strain for women, or stress. And this was seen as particularly challenging for those in dual serving couples, so families in which parents or both parents, of the couple are serving, and they have to juggle work commitments, particularly with childcare arrangements, deployments, unpredictable working hours. And large survey data in the UK also suggests that women are more likely to leave the armed forces early, and the most common reason cited for this across a number of studies, and also by our subject matter experts, was due to pregnancy or having children and family related reasons. And this is supported by qualitative research that we identified, that suggests that becoming a parent significantly altered the career trajectory of women who were interviewed. So despite the fact that restrictions on pregnancy were lifted a number of years ago now, women are still leaving most commonly due to having children or for family reasons. So lastly, in terms of in-service issues, and this is a kind of particularly contentious issue, I think, one that's been raised recently by the Defence Select Committee evidence sessions on women in the armed forces, and is also picked up often by the media, and that's looking at sexual harassment and violence in the military. But what do we actually know from the evidence base? Well, we found no peer-reviewed academic research papers in the UK that looked at this issue in the UK Armed Forces, but we did identify hundreds of papers focused on this in the US. What we did find in the UK were a number of surveys that have been conducted by the Ministry of Defence and also the Single Services, a research report, and also some PhD theses that have discussed these issues for women in particular. And when looking across occupations more generally, male-dominated environments, and in particular the uniformed services, are found to report the highest rates of sexual harassment directed at women. And indeed, when we look at reports and surveys spanning from around 2006 to a couple of years ago, these suggest that a sexualised culture does remain a problem in the UK Armed Forces. Women are more likely to report all forms of harassment and targeted sexual behaviours, with up to 70% reporting some form of targeted sexual behaviour in these surveys. Although those proportions differ across the surveys, I would say, but this is the most that's been reported, and that's from unwelcome sexual comments up to sexual assault in the past year. However, these surveys also suggest that similar proportions of men and women appear to report sexual assault, so on the more extreme end of that spectrum in the past year, at around 1 to 2%. Excuse me. And while these surveys report prevalence in current service personnel in the past year, there is a lack of research in the UK looking at prevalence over the course of military service, or the experiences of this in female veterans. We did find one study looking at this in a qualitative sample of 100 female veterans, and in this sample, over half reported sexual assault during service. However, we need more research to be sure of how representative this sample is of the wider veteran community. In every report that is available, women and men talk about a reluctance to make a formal report and a lack of trust in the military complaint system, and women are overrepresented in this system. Women also report fear of repercussions on their career and work environment if they report. And our subject matter experts also highlighted, of course, the impact on mental health and help seeking that this can have, but we have little evidence, again, in the UK to illustrate this at the moment. Whereas in countries internationally, particularly the US, there is a significant body of research linking military sexual trauma, which is how they term it in the US, to poor mental health outcomes and difficulties adjusting to civilian life. So this brings me on to what we know about the health and well-being of women post-service. And we identified, as I said, quite a lot of evidence related to health. 13 papers were looking at physical health in female veterans, and this was either comparing them in terms of their physical health to male veterans or to female civilians. And I've donated this in these slides as MV or FC, so you can see where those comparisons are made. Again, these were dominated by large survey cohorts. And differences between male and female veterans in terms of their physical health was mostly in line with civilian gender differences in health conditions. And I've highlighted a few differences here, but again, there's much more detail in the report if you're interested in this. When looking at the comparison to female civilians, there are certain types of cancers, particularly ovarian and breast cancer, that are more common in certain cohorts of female veterans, and also increased levels of hazardous drinking were found in female veterans compared to civilians in one data set. And whilst not identified in the literature here, our subject matter experts also highlighted problems with musculoskeletal problems for female veterans. And this is also reported in an MOD report, which found women were more likely to report these problems as a result of training. But again, we need more research in the UK to determine if this is a particular challenge for women. So when it comes to mental health, most evidence in the UK suggests, again, few differences to male veterans. However, self-reported common mental health symptoms appear to be higher in women compared to men, but we found that this was only in samples that consisted of both serving and ex-serving personnel. And actually the studies that were looking at veteran-only samples, and also studies looking at formal diagnosis rather than self-report, did not report these differences. Additionally, there is evidence that women are at lower risk of suicide, suicidal ideation, self-harm than male veterans in the UK. When it comes to the comparison to female civilians, there are some differences of note. Female veterans are 2.5 times more likely to report probable PTSD and appear to be at 2.5 times greater risk of suicide and suicidal ideation to civilian women. Additionally, what the Scottish Veterans Health Cohort study found was an increased likelihood of suicide in women who joined the armed forces prior to the 90s compared to those who joined afterwards. So this suggests that there may be something going on in terms of when women served and their risk of suicide. But again, this finding requires more investigation to determine if it's generalisable. So for both physical and mental health outcomes in female veterans, there is a significant lack of qualitative research looking in depth at why there may or may not be differences in health outcomes and the experiences of physical and mental health for female veterans. So moving on to our more kind of socioeconomic outcomes, there is a lack of research looking at women's financial and housing security in the civilian world, although our subject matter experts highlighted difficulties experienced by those who leave or left earlier than planned due to things like pregnancy. In relation to employment, female veterans are more likely to be unemployed, but less likely to claim unemployment benefits compared to male veterans. However, the evidence is a bit unclear in this area, particularly in regards to economic inactivity. So those who are unemployed, but are not necessarily looking for work, and how this might be related to things like caring responsibilities. There is qualitative evidence of underemployment in female veterans, and what I mean by this is them not being able to necessarily get the job that they would like, and the majority of women who are not employed in these studies wanted to be. Women, like men in the veteran community as well, report difficulty selling themselves to employers and recognising their transferable skills. But again, in terms of employment, we need more in-depth qualitative research to look behind some of these stats to understand why women might be less likely to be employed, and as I say, in particular, how this might be related to economic inactivity and other responsibilities that they may have. Finally, it was felt by our subject matter experts that improvements could be made to employment support and resettlement to better suit women. And this was supported by qualitative evidence, but these suggested that support in terms of resettlement and employment may be targeted towards the more stereotypically male occupations and could be better tailored for women. In terms of social relationships, UK and international research suggests that there are higher levels of separation and divorce in female veterans compared to civilians. And our subject matter experts discuss the difficulties of maintaining a relationship while your partner is still serving potentially. So for those in dual serving partnerships, again, who then may become a military spouse and have to relinquish their own career whilst supporting their partners. Now, in terms of broader social networks, the evidence is a little inconsistent. Some survey data suggests that women are more likely to report higher levels of social support, but are less likely to access it than men. However, other research reports no gender differences at all in social networks. Our subject matter experts suggested that potentially peer support strategies should be developed for female veterans, and our stakeholders in our workshop agreed with this and suggested that a national female veteran support network would be a good strategy for supporting women. Now, in terms of identity, female veterans reported in some studies that they were less likely to identify with the veteran label. And qualitative research suggests that female veterans may perceive this label to be associated with not just the kind of older male veteran cohort, but also combat veterans, and may not perceive themselves to fit this. There's also some evidence that they would prefer the use of ex-service or ex-military. However, this isn't to say that women don't feel pride in their service at all, but sometimes felt, at least in some of these studies, that they were less recognised in society as veterans. So it does appear that there is work to be done here in terms of how women identify and how that might relate to their well-being and support needs after service. So in terms of help seeking, peer-reviewed evidence suggests that female, both serving and ex-service, are more likely to access formal medical support than their male colleagues. And this mirrors the general population. However, we know very little really about how women access and experience veteran-specific support services, for example, those provided by the NHS and the third sector. Our subject matter experts felt that there was a lack of engagement with these veteran support services, and that this was due to either a reluctance to attend these male-dominated veteran services and events, also potentially related to a lack of awareness of these services or their eligibility to these services. Our subject matter experts also had mixed thoughts about the need and desire for gender-specific services. Some felt that these were really essential, particularly for women who had experienced trauma in the male-dominated military environment, whereas others highlighted potential negative implications of segregating women as a minority group, and felt that some wouldn't want this. However, there is emerging evidence in the UK that women may experience specific barriers associated with their gender to engaging with veteran services, often at least in the emerging evidence, as a result of experiences during service. And these are things like the negative gender stereotyping that I mentioned earlier, but also the awareness of civilian healthcare professionals after transition of women veterans' needs. So more research is needed really to investigate this further and to look into what veteran organisations and support services can potentially do to meet women's needs. And this was something that our stakeholders focused heavily on in our workshops and felt should be a priority for the sector. Okay, so that was a very quick tour through the main findings, but I want to highlight now what the kind of main gaps and limitations of the evidence base are, which, as you can tell, is very broad, but fairly superficial. And what I mean by that is that there is quite a broad range of topics touched on, but very few in much detail. So whilst the evidence base is increasing, we have only really started to scrape the surface here in terms of women veterans' needs. However, we still lack evidence in a number of areas, in particular the socioeconomic issues faced by female veterans after transition, and how these and their broader health and well-being are impacted by their experiences in the military, and the impact on women who served during the historic terms of service as well. And service era is something that we think really needs to be considered in research with women veterans going forward, as the impact of those historic policies could have quite a significant impact on their well-being and needs after service. And there are also a number of other limitations in the evidence base that a report goes into detail on, regarding the lack of in-depth qualitative and mixed methods research, issues with intersectionality and grouping all women together, and the relevance of older studies to the modern serving population and the need for more research. Okay, so in terms of our recommendations, and I'm not going to go through all of these, as I don't have time, but we split these into those related to support and policy and those related to research. And these were developed, as I mentioned, with stakeholders following presentation of our findings. And once we had these priorities from the perspective of stakeholders, we then amalgamated these into priority levels based on comparisons of what was ranked as important across the different groups. And the report goes into more detail in terms of how we did this, if you're interested. In regards to support, the top priority was around ensuring that veteran support services are adequately targeted and tailored towards female veteran support needs. And this was following emerging evidence that I've mentioned already, and evidence internationally that women underutilise veteran services. And our stakeholders felt that this was the case as well. So we recommended that Veteran Support Service look at their offer for women, look at how women are engaging, and examine whether they are meeting women's needs. We've also put forward a number of recommendations to the Ministry of Defence for looking at circumstances in service and how this might be improved for women, amongst other recommendations for ensuring that specific types of support are improved for women in the civilian world. Now, in terms of research, both stakeholder groups felt that it was really important that research focused on the impact of sexual harassment and assault in service on female veterans. And this was followed closely by examining how the male-dominated military culture more generally impacts on women in terms of their experiences during service. And this was following recognition of the evidence that I've talked about in this presentation, that the masculine nature of the military is associated, or at least has been historically, with attitudes and behaviours towards women that are impacting on them negatively during and potentially after service. And there are many other recommendations in terms of research, emphasising the lack of in-depth research in a number of areas related to women's health and well-being. As you can see on the slide, there are a number here. And again, you can look at these in more detail in the report. So what we've tried to do here is to provide a prioritised framework for taking forward activities with female veterans in the UK, based on both the evidence base that we already have, the gaps that we've identified that exist, and then stakeholder perspectives on how we should prioritise this going forwards. So that's the end of my presentation. I'm happy to obviously take questions in the Q&A, but if anyone wants to contact me, I'm happy to take emails as well. We have, I've added a link here to the report, and hopefully someone will pop that in the chat for you. But I also just want to acknowledge all the other authors and organisations and participants who put their time into this report as well. Thank you very much.
Lauren, thank you very much for that fascinating and thought-provoking presentation. I hope and expect that it's generated many questions, and I would now like to introduce Kate Davies, CBE, the Director of Health and Justice, Armed Forces and Sexual Assault Services Commissioning within NHS England and NHS Improvement. Now, Kate leads on cross-departmental work, and that of course has led to the development of the National Partnership Agreement with the Ministry of Defence, and it's produced a strategic vision, aims and interactions, and a governance framework, all of which will allow for mutually supporting work and commissioning for the armed forces community. And I must mention, I think, that in particular this has resulted in the commissioning of UpCourage, which is the Veterans Mental Health and Wellbeing Service, the development of Armed Forces Personnel in Transition Strategy, the Integrated Personnel Commissioning for Veterans Framework, goodness, and veteran-friendly GP accreditation, and plans to provide improved care for armed forces family. So a wonderful series of things that are coming forward and helping women veterans. Kate, over to you.
Thank you, Deirdre. Can you hear me loud and clear? I'm taking that as a yes. Okay. Good afternoon, good morning, sorry, good morning everybody. I hope you can hear me. It's really important to be part of this event today. I'm just checking. Deirdre, can I just check that you can hear and see me, because I'm not yet seeing myself on screen?
Yes, Kate, we can hear you and we can see you. Thank you.
Thank you. I apologise, everybody who's listening to this on my my hesitancy. So yeah, thank you for inviting me to speak at what I think is an incredibly important event today, and thank you very much for the overview, Lauren, from the report. There's much to think about and there's much to digest, and but what is really important, and I want to start with this, is this is also about championing women within the military. This is about the amazing impact and input that women with men and for themselves have made over history, and can absolutely be and can be for the future. We often talk about what this means for women, for example, in the NHS, and how important a major services like the NHS of the women that are part of the NHS. And it's really important that we can use this report, we can use the findings to really see what it means for women within the military. I think it's important to say that the NHS is really pleased to play quite a small part in this. We've often talked about at the moment that there are many moments in time to do with women's equality and women's issues. And this is, for me, another moment to celebrate not women only in the military, but also how we can improve and support both the physical, the mental health, the well-being, but the employment and the career options for women, and women and men who absolutely are passionately committed to serving their country, to supporting what this means for their families, for their loved ones, and for the community at large. So I think the first question that everyone should be asking in listening to the report, reading it later, is what can you do? What can you do maybe as part of your own individual elements, but as part of your organisation, as part of your representation, whether that's with the government, with the public sector, with charities, or even just yourself and your families, which is incredibly important. NHS England has really committed through a forward view to supporting the developments for the armed forces community, both reservists serving their families and carers and veterans and their families and carers. And it is essential that we look at the various different elements of the equalities, the inequalities and the health dynamics of the armed forces community. And for women who are 11% and growing of the military community, we know that that is an essential element to give it the focus that we've just been looking at. I really want to go back to Deirdre's introduction really about what's appropriate, what's inclusive, what's accessible, but also I think what we're here to do to really make quite sure that we improve on some of the stark findings and also some of the elements which are cross-gender as well. I know that there's been much evidence and much lived experience feedback from many women, many men also within the military, many families on women's experiences. And we've had and been part of working with excellent organisations like Fighting with Pride, Salute Her, and also Operation Courage, the Veterans Trauma Network, accredited services both in hospitals and with GP accreditation for the armed forces community that come back time and time again to look at and support and give the voice of women and families as part of the evidence that's come in with the report. So I'm pleased to say in the very short time that I've got to celebrate women in the armed forces, to challenge and work and support with the actions from this report and many other findings and lived experience, that NHS England will be supporting alongside with our partnership with the charitable sector, with Cobseo, with partners in the MOD and the Office for Veterans Affairs, a women's work stream to completely support and drive forward the needs and change within that, whether that's physical health, mental health, some of the elements on health inequalities, on sexual violence, on what that means for employment and careers, and absolutely making quite sure that this is something that we support through continued monitoring and evaluation. what I will say is, just maybe to finish off in, as I say, I could go on for a lot longer about this, is that I'd like to particularly thank the women that have given their time and their energy to support this work. I'd like to thank the men as well, who particularly as leaders in the past, and for men and women as leaders in the future, really have a place to support and champion that, as it's been done through history and many elements of employment and an attitude. I know that women in the armed forces are an essential element. I know that looking at health and well-being, both physical, mental health, and also what that means for health inequalities and supporting some inequalities and behaviour is essential for the future. But as I know, as supported in Op Courage, we've now got 12% of women that are actually now accessing the Op Courage mental health services, and that is growing. It is really important that we continue to champion good practice, we continue to champion and take on these challenges, however difficult they may be at times, but we continue to listen, support, and particularly make quite sure that this is a career and an element that really is very positive for the future, and we learn those lessons for change, but also the lessons to champion what is great and what really is really important as part of women in the military. So thank you.
Thank you, Kate. We are really grateful for your support. I'd now like to introduce Jessie Owen, who will be taking over as co-chair of this meeting. Jessie became the new director of the Office of Veterans Affairs in spring this year, and as such, she has a truly pivotal role in helping us reach out to all government departments, in helping shape policy, and in making sure that the female voice, the female veterans' voice, is heard. Over to you, Jessie.
Thank you, Deirdre, and thanks for inviting me to join you today and giving me the privilege of chairing the panel discussion that will be coming up shortly. Like Kate, I'm just going to assume that you can hear me and keep talking, and somebody will flag if you can't. It's really great to be alongside colleagues from the Ministry of Defence and NHS England speaking today about such an important issue. And I think the fact that we're all here and we're collaborating on this report's findings illustrates how seriously this is being taken across government. And again, thank you to Lauren and the teams at Anglia Ruskin and to Cobseo for their work on this report. It is a tough read in places. It's got some really sort of difficult challenges for us to address, but it's really valuable to our work in the Office of Veterans Affairs. So I'm going to keep it brief and speak about three things: equality being at the heart of what we do in the Office for Veterans Affairs, our short-term aims to embody this, and then an ask of all of you dialed in today. I have only been in post a few months, as Deirdre outlined, but I've already been really impressed at the breadth of issues that our small team in the Office for Veterans Affairs is tackling on behalf of veterans across the UK. We were set up just in 2019, and our aim is to drive cross-government implementation of the veteran strategy, so make sure that all the various bits of government are doing what they need to do. And foremost is making sure that we serve every veteran equally. And this includes addressing some difficult conversations around historic hurt with groups in the veterans community, something that this report and its findings have illustrated really well. And as Kate just said in her introduction, championing the women who serve in our armed forces, ensuring that their amazing service is recognised and valued. We want to make this the best country in the world to be a veteran, and that means every single veteran, recognising the diversity of who our veterans are. And it's vital that we consider the perspectives and experiences of female veterans, their partners and their families, and we consider that right from the start as we develop all of our veterans-related policy. You'll be pleased to hear that we've got a Veterans Minister who's keen to ensure he sees real progress on this. So we'll be accelerating our work to publish the next iteration of the strategy for our Veterans Action Plan by the end of this year. So for the first time in this action plan, we'll include actions specifically targeted at female veterans. The action plan will set our agenda across government of our policies and our commitments from 2022 to 2024. So I'm really pleased that we'll be including dedicated work on how to support women. We'll be looking really closely at the recommendations coming out from this research and how we can take forward the policy change aspects and further research. And to all of you joining the launch today, I have a really small plea, which is to keep telling us what's working and what isn't. Sort of your feedback is so important to us. Your contributions to discussions and research on these issues are what help us kind of take this agenda forward. So whether it's through roundtables like the one that the Department for Health and Social Care hosted with us last month, looking at women's health, providing evidence for Defence Committee inquiries, or contributing regularly to the work of the Cobseo Female Cluster, your kind of lived experience and willingness to share it with us has a huge impact. And the discussions that we're able to then have with ministers across government and with policy teams, and then turn that into sort of tangible change that will make a difference to female veterans. And the OVA's door is always open. We want to have these discussions with you. And I know this thought-provoking research will help prompt us to have further discussions and do further work on these issues. Finally, I hope that launching this report in Armed Forces Week sends a really strong message to female veterans. So yes, this week is about celebrating the outstanding achievements of service personnel and veterans right across this country, of course including the massive contribution of female veterans. But it's also about listening to our armed forces community, supporting them, and ensuring that where we haven't always got things right, we address that openly and at pace. So the Office of Veterans Affairs is really committed to making sure that every veteran is treated well after service, that they get the support they need, and they can go on to maximise their potential. We've still got a lot to do to make this a reality, but it's research like this that will help us get there, and I'm really grateful to everybody that's been involved in today's report. I think I'm now handing over to Helen Helliwell, who is from the Ministry of Defence, who will give an introduction and talk about the Ministry of Defence's perspective. Thanks, Helen.
Thanks very much, Jessie, and thanks very much for inviting me here today. Great to be with colleagues from across government, the NHS, third sector and academia. None of us have answers to do this on our own, so it's great to have the collaboration. Obviously, it's mission critical for Defence to maximise the talent of our people, and that includes improving the experience for women in the armed forces in every aspect of their lives. So Defence really welcomes this report. It will help focus our activity to ensure that we get the best outcomes for women, be they serving or ex-service. It's also really timely because, as Lauren alluded to, we've also got the House of Commons Defence Committee, who recently launched an inquiry into women in the armed forces from recruitment to civilian life, which has also provided some at times difficult reading, but really useful insights to help us target our actions. We're expecting them to formally report in the next couple of months. So as well as thanking NHS, Cobseo, Angela Ruskin, OVA, a huge thank you to all the current and former serving women and men who've contributed to this research. It makes clear that on too many occasions Defence has fallen short, and those working in it, but there's lots that we are doing to address that. So, and we are making progress, and I think the majority of women do have fulfilling careers in the military. More broadly, we've opened up all roles for women. We've embraced flexible service, so you'll be aware that in April 2019 we introduced flexible service for men and for women, but I think it particularly helps those with families or caring responsibilities to ensure that they are non-deployable or don't have to spend so many nights away from home. I think our COVID ways of working have introduced even more flexible working arrangements, which we'll look to take forward too. We're introducing wraparound childcare for everybody from September for those with 4 to 11-year-olds, and again, of course, that's relevant to men too. And we've designed some specialised support for those returning from starting families. Linked to this, we're also publishing the Family Strategy and Action Plan later this year, which follows the independent report Living in Our Shoes, which many people perhaps on the call will have contributed to as well. And alongside that, I've noticed that the transition was one of the recommendations in this report. It was as well in Living in Our Shoes. So we're looking at our transition policy. And we're also looking at our career transition support. So the transition policy is really holistic, looks at all areas of life, and then the career transition partnership, particularly looking at transition into employment. And then there's wider things like our accommodation strategy as well, which we're currently reviewing. So lots of things that we hope will improve the lived experience. But I think particularly pertinent to this report is a renewed emphasis on women's health in the health and wellbeing policy space. So we've brought in new policy on health during pregnancy and post-pregnancy, providing pre and postnatal advice for serving women to support safe exercise. We've updated our guidance on assisted conception. This is particularly around medical treatment, additional funding and leave entitlement, geographical stability whilst people are undergoing that. That was released a couple of months ago. With respect to physiotherapy, Defence Healthcare facilities now provide occupationally focused women's health physiotherapy service to ensure that we're promoting early identification and treatment for common women's health problems. And for the first time, we're now providing sanitary product provision for women who require it in austere environments. Looking ahead for the rest of the year, we're developing policy on menopause and breastfeeding, as well as looking at new opportunities for wider women's health policy development. So this kind of research will be critical to that. As I and others have alluded to, and as the recommendations have found, it is, of course, wider than just health and wellbeing. So the new Directorate of Diversity and Inclusion within MOD brings together the existing D&I team, but also with complaints and service justice. And it's also nestled in Defence People. So Sam Deforge is part of the same leadership team as I am, to ensure a coordinated kind of cross-cutting approach to tackle fairness, equity and justice in defence and make real change for our people. We've seen the gender networks and champions play a really important role. We've got lots of different gender networks which work to drive forward inclusive working cultures and help provide policy back to us who are making policy, raising awareness on issues around diversity and crucially feeding back the lived experience. We also have a gender balance working group. I think it's well publicised the lack of senior level women in the military. It's improving every year, but that working group has got a real target to reach 30% representation of women at 2-star and above by 2030. The ways that they're looking at doing that are things like lateral entry, which was introduced this year to support rejoiners and new joiners to bring their skills into the armed forces at the right level. We're modernising the appraisal system and job specification to ensure it removes those kind of gates and criteria that aren't necessary and disproportionately impact women. And of course, the families test policy has been in government policy making for some time now, but that's a renewed emphasis to make sure that the modern family is recognised in policy making across such a broad range of areas. So there's lots planned and lots more to do. So grateful for all those who've taken the time and effort to feedback their experiences. I think it's so important that we use this to really seize the moment and drive real long-lasting change. Of course, we can put all the policies in place that we like, but it's incumbent on everybody in the organisation to exploit and embed those. And, you know, just to end on, our diversity is definitely our superpower. So looking forward to working with everybody to make this a lived reality. Thanks, Jessie. I think I'm handing back to you.
Thank you. Yes, you are. I can't put myself on video, I'm afraid, because it's saying the host won't let me, but we'll try and sort that out. I'm going to introduce now. There we go. I'm going to introduce now the panel that we've got to answer questions, and if there's some great chair questions already coming in the chat, do keep putting those through and we'll feed them to our panelists. So I'd like to welcome back on screen Dr. Lauren Godier-McBard from Anglia Ruskin, Kate Davies from NHS England, Helen Helliwell from Ministry of Defence, Deirdre Mills from the Cobseo Female Veterans Cluster, and Emma Brown, who we've not seen before, but she's a policy lead from the Department for Health and Social Care, working on armed forces, community and women's health policy. So welcome, and we'll kick off with one of the questions that has already come through on the chat. Start with some questions for Lauren about the research itself. Lauren, to what extent did the study encounter the combined disadvantage of female and LGBT as veterans, and is there a need for a closer look at that sort of kind of overlapping or co-complexity?
So the answer to that is no. We didn't find any existing evidence in the UK that looked at that intersection between women's experiences and LGBT experiences in the veteran community, but our subject matter experts did highlight this as important, and particularly around the repeal of the ban on homosexuality and how that ban may have impacted on not just the mental health of women that experienced that or left service because of that, but also the socioeconomic impact of having their careers cut short. So this is definitely an area that needs to be looked into more, but at the moment, no research in the UK.
Thank you, and that kind of illustrates one of your key findings is more research sort of being needed. Yeah. Further question really about the sort of research you found. So in terms of employment, did you find that female veterans were attracted to the same types of roles and industries as male veterans, or do they tend to move into a very different sort of employment sectors?
So I think that was a little inconsistent across different studies that we looked at. There were some roles that women were more likely to go into, such as healthcare and administration roles, but some were picking the more kind of you know, those roles that you might think of in terms of veterans going into the male-dominated environments, such as the police, logistics, those kind of jobs. But I think what was important in terms of employment were that, and this was particularly from qualitative research and from subject matter experts, was that women felt like they needed a little bit more support in terms of how to transfer their skills into maybe those less typical veteran employment directions, I guess, if that's the right word. So they felt that they needed potentially more tailored support for them if they did want to choose. I don't want to say those kind of female typical roles, but maybe roles that women might want to go into more that are potentially more flexible, or, you know, self-employed roles as well. So I think the findings were more around what women felt they needed in terms of support, whereas, you know, different stats around the employment that they were going into kind of varied in those terms.
Thanks, Lauren. And this links to another question, which Helen, I might ask you to come in on first. Do you know sort of how we're going to, how the findings might help shape the careers transition partnership and sort of the resettlement and transition support that the MOD offers?
Yeah, so we're reviewing that at the moment. So we're taking into account the report's findings as we review that policy, along with the other evidence we've collected through our own kind of reviews, and that's through, and also through the House of Commons. So yeah, that should be happening over the next couple of months through to the rest of the year. We'll definitely look at that in shaping how we offer our transition support.
Thank you. Kind of a broader question, I think I'll go back to you, Deirdre. Why do you think that the issues specifically facing female veterans haven't been examined in detail before?
Oh my goodness, I think that's quite a loaded question, Jessie. Well, I think partly it's about numbers, and partly it's about the fact that female voices have not been heard at the very top levels. And we can see that in the number of, you know, top female military officers. It's different across the services, but for example, there are only 1 or 2 female generals in the army. And I think unless you've got those voices in at the very top levels of policy, then it's very difficult for us to address those issues, because those issues aren't considered a priority, or aren't something that the people making decisions have experienced or been alerted to. And so from my perspective, bringing a female voice into every level of decision making is incredibly important. And what the beauty of this report does is it helps focus the activity, or focus the mind on these particular pieces, and therefore supplements the female voice when we can get it in. So I think for me, that's the main challenge, is finding a female voice at every level of decision making across the services, and particularly up at the top in terms of the military, but also in terms of government.
Thank you. Kate, I believe that you or your team commissioned this research from NHS England. And what's your perspective on sort of why this was kind of so groundbreaking, and why there are still so many gaps in what we know about female veterans?
I mean, it's no secret that obviously the NHS has been really proactive in partnership with the MOD and the charitable sector and yourselves in the OVA on supporting and championing the needs of the military community. And you can't champion the needs of the military community, both serving and non-serving, and families and carers, without looking at different elements of it. And I love Helen's quote earlier about diversity being the superpower. And I think the issue, is that we were very aware from women and men that we were speaking to that there were some real stark gaps in knowledge, and there were some stark gaps in addressing inequalities. And there is only one way that you can do that, often when that voice has sometimes not been heard at the level that you would like it to be in change. And we've seen that in many other walks of life when it comes to women. And it was really important to focus and give the time and give the structure to looking at what does that mean for women who also serve. And I think it is really important also to emphasize that often in when we're looking at the needs of gender. And I also have the pleasure of working in other areas and leading in other areas where we're looking at what that means for women in different aspects of their journey into the NHS. You have to not necessarily look for big numbers. You don't necessarily need to look for big outcomes. You have to go with where sometimes the smaller numbers and the smaller inequalities are saying an awful lot for many people who are hidden. And that is absolutely essential. And it's not about being negative about those experiences of women in the military. We know that it is a great place to be and a great place to serve, and women want to be there. But we want to maintain that, and we want to also address some of those health elements that are different, whether that's physical health and what that means for MSK and injuries. What does that mean for particularly mental health? And what does that mean, as you know, as Helen has outlined really eloquently, there are a number of issues, what that means for the menopause, for pregnancy, from conception. What does that mean when you are obviously in a male world? I will be really happy, as many other women have put their heart on their sleeve for this report, to my heart on my sleeve. It's not always easy in leadership, and it is not always easy, you know, for working through some of your own personal issues. And it shouldn't be a barrier to being a woman to actually be part of that voice. And I'm being fairly passionate, I suppose, at this point. I have worked with leading the military and armed forces work for the NHS, and I'm really proud of that. And my colleagues, both male and female, work together to support this agenda that we're looking at today. And I think that's the bit that has really championed why we're doing this, with our academic partners, our military partners, and with our charitable partners, but absolutely doing that on behalf of women and behalf of women and men for the future. And for that, I think this can be a really positive step, and is a really positive step for what's to come.
Great, thank you. And building on that, there's a question around what outcomes do we expect to achieve from this report? So what change do we expect to see off the back of it? Emma, I'm going to come to you next from the Department for Health's perspective. You're on mute, Emma. It had to happen at least.
It was bound to be me. So apologies for that. Yeah. I think thanks for giving us a chance to speak. So what outcomes? I think we just want to listen again to the women. I think this sort of ties in nicely with the Women's Health Strategy Call to Evidence that the Department of Health and Social Care has just launched, which were not just closed, sorry, which included a question on veterans' health to sort of try and get sort of women's issues broader and all their health issues, health and sort of follow on from this, and how that fits in with the women's strategy and what they're trying to tackle. To sort of focus on women's health, follow on and to act on the inequalities that we found in the call to evidence and in this report highlights. I think the outcomes that we've got, the NHS England has set up a ex-servicewomen and servicewomen steering group that we're members of, that we're going to be looking forward to take forward these recommendations across government. I know that the OVA is sitting on that panel, as well as myself and some other cross-government departments, as well as NHS England. And I think that's really important, that we work together to look at these recommendations and to try and delve deeper into what they mean and what those outcomes, how we can improve the health and wellbeing outcomes for these women.
Thank you. There's a question here on research sort of priorities, and flagging that whilst the impact of kind of sexual harassment and assault is likely to be massive, does the panel think that some of the lower priority needs could be potentially more actionable in terms of quick wins and having sort of faster change? So should we give them sort of greater priority in terms of what we want to take forward? Deirdre, what's your perspective on that?
Gosh, I think that's another really difficult question, because the key is to get some action and to make some sort of tangible change. But on the other hand, I don't think we should shy away from the conclusion that there has been huge difficulties in the area of sexual harassment and sexual assault, and to not give that a prominence or not to give that a light, I think would be tantamount to denying what is actually happening and what is out there, and it must be dealt with. So you could argue it from either side, and I can see merit in both. And I think what we'll try and do is take it forward best we can, tapping into all sorts of people who can help in all sorts of different ways. But I would say that the priorities are there for a reason, and that's because we've gone through the literature, we've asked subject matter experts, we've gathered the evidence, and with the evidence, I think no one can deny what has happened or what is going on, and we really do need to push for an in-depth review and some action on something that is a really difficult decision, a really difficult area. And I would point really to two particular reports which have come out. One was the Watts Andrews report of 2009. The other was the Wigston review in 2019. And it evidences that issues such as sexual harassment and sexual assault are still continuing, even though there have been great strides forward in helping women and making service life much more accessible and better for both men and women to operate on. So operate within. And so, you know, we have the proof, we have the evidence to say this is still an issue. It is still going on, and it cannot be hidden away under the sofa. It needs to be absolutely tackled and addressed. And so my view would be, yes, where we can get quick wins, we take them absolutely, but we don't do so at the expense of tackling an issue or the top issues that are still of huge concern and have major impact, particularly on the individual women who experience them.
Thank you. So a question's been posed by somebody who has an opportunity to sort of help publicly kind of highlight these issues. I'd be interested in a really quick answer from everybody on the panel. So what do you think is the one key message that needs to reach the general public arising from this? Lauren, starting with you.
That's a really difficult question. One key message, I think for me, first of all, as other people have said, is that, you know, most women will have a successful and happy career in the military. But what this report highlights is that there are also a significant number of challenges and issues faced by women that still need to be addressed to ensure that it is, you know, an inclusive environment that doesn't have an adverse impact on them during and after service. So I think in a nutshell, for me, that's the kind of key takeaway.
Thank you. Kate, your one key message?
I think my one key message is that that this is saying something really loud and proud about women, and we often talk about the military community and careers in the military and what that means to be a veteran. And I think there was a question about, you know, the term veteran for women and whether you should have that. So I think one of those messages is for me is making quite sure, whether it's the term veteran, whether it's about serving, that we absolutely recognise that women are central, women are here to stay, and that women absolutely have got so much to be and to give within the military, and our male and female counterparts together can really work hard to support this. I have to say, going back to Deirdre's point, is that often this hasn't been talked about because people have worried that this might prevent people thinking that women's careers in the military is a good place to be. You can see by the panel today, for the first time, I think this is the first time I've ever been in an all-women's panel for the military voice. I think it's actually the opposite to that. That's my key message. This is about saying that everybody is working to support diversity and difference, including what that means for LGBT, Black and minority women, disability and age. And this is a great place to be because it's been addressed and will continue to be addressed as part of diversity superpower. Thanks, Helen.
Helen, assuming Kate hasn't stolen your one key message. Reinforcing that. Oh, so mine kind of follows on from that, really. I mean, women play a vital role in the armed forces, and just like other underrepresented groups, we just need to remove barriers and enable them to fulfill their potential. I think it's as simple as that, and using this kind of research helps us to enable to change our policies. And it's culture and leadership challenges too, though. It's not just going to be done by policy change alone, but yeah, women continue to play a vital role, so let's enable them to fulfill their potential in doing so.
Thank you. Emma?
Yeah, I just want to echo everyone's comments that they've made, and I think just sort sort of to say that it's just really important that we listen to women and that we continue to listen to women, both as part of this report and any further research that comes out from it, and also the women's health strategy. So thanks.
Deirdre, final word.
I think it's that diversity is a game changer, that it makes us better, not just as individuals or as a society, but actually it's better for defence. And in order, because we have all these different perspectives, and in order to achieve that, we really do need a female voice and diverse voices at every level of command and across the whole of society, but specifically in this instance, across the military. At the lowest level, but equally at the highest level, and we should be pushing for that in order to provide the best defence that we can in the world. Yes, and I think I'll stop there.
Thank you. There's a question here on an issue that Kate touched on, which is whether women who have served in the armed forces actually identify themselves as veterans, and this is something, a bit of a quandary for us in the Office for Veterans Affairs, because that's what we're called, but we are here absolutely to serve every veteran, everyone who has served in any aspect of the armed forces, kind of male or female. But Lauren, could you perhaps just expand on that? And did the female veterans who you talked to in your research, and what did you find that they kind of identified with that? And if not, sort of what terms did they identify with?
Yeah, so I mean, the evidence that we found in our scoping review, and it was, again, like all areas, limited, did suggest that women were less likely to identify with the veteran label, and qualitative research found that this was because they and also the public more broadly associate this more with both combat veterans but also male veterans, and particularly older male veterans. So women in those studies and also in our stakeholder workshop highlighted the fact that they didn't necessarily identify with this, and the preferred kind of terms were ex-military or ex-service, and they felt that this kind of more broadly reflected everyone in the veteran community.
Thank you. There's a question here for the OVA, which I will pick up, which is whether we are going to commission any further research on female veterans. We're hoping to publish a research strategy for veterans by the end of the year, and a key part of that will be understanding sort of what we can do to build on the veterans question that was in the census for the first time this year, which will give us sort of an unprecedented level of data about our veteran cohort, including female veterans, sort of where they live, their employment status, socioeconomic health, sort of what their household looks like, and our ability to then to link that up with other things that government knows about our service leavers will tell us more about our female veterans than we'd ever known before. And we absolutely want to make the most both of research that we commission directly from the OVA, from other bits of government and the charity sector, to build that kind of evidence base, if you like, for where we can best sort of intervene from a policy and service provision perspective to support female veterans. So that really will be kind of highlighted as one of our priorities for the next few years. I don't know whether, Kate, you want to say anything. I don't know if there are further plans. I know that the NHS funded this research. I don't know if there are further plans to do more research, kind of building on the findings of this report.
I mean, when we first obviously saw the report, I think that what I welcome is Lauren's summary that it's got recommendations in different areas, and those recommendations are obviously about access and action now, and accessibility, and what we're doing to support and look at those needs both for physical and mental health and sexual health. Then there's the element on policy, and then there's the element on research. There's absolutely no doubt that there needs to be more research on what this means for the military community, what this means for women, what it means for other elements of diversity. But I don't think that needing and wanting more research should distract from the fact that there is enough that we can be looking at and supporting as part of actions for change and for policy as well. And I know that the Forces and Minds Trust has been absolutely superb and really championed this as part of the research agenda for many years now, and I know that will continue. Cobseo the same, and of course the NHS is absolutely wedded in everything we do as part of evidence and research, but I think it is also about what we need to do to look at all of those three elements together, which I think is absolutely essential. So I have to say very selfishly that the majority of the funding and the commissioning and the collaborative approach for population-based commissioning for the NHS is about delivering our services and delivering in every community around the transition agenda, around the veterans agenda, around young women who maybe are thinking about joining the military and what that means. So we'll particularly be championing this at the next stage of this report, but I welcome that additional research is looked at. I mean, it's really stark, isn't it, that the number of the dates that we've been given as part of the evidence and the research is so recent. And actually we're talking about 2019, 18, 16, if we're lucky to go back to 2009 or even beyond that. So I think that probably is telling us something, but I think that it is really important that we also look at what we can change, do, improve, or keep going now, alongside all of the work that we're all doing together.
Thank you. The next question is kind of building on some of the discussion we've had about the kind of wider public perceptions around veterans and the assumption of veterans being sort of older and male. Is there more that we can do, although it's already being done, particularly from a sort of marketing and communications perspective, to change the sort of representation of what we mean by veteran and to kind of improve representation of women, particularly to attract them to support services? Helen?
I think there's more we can do to support a female network for those who've served. I think there was some comment in the chat about some groups that have been set up for Sandhurst, etc. But perhaps more broadly, when we look at regimental associations and veterans groups, potentially they tend to be more male dominant. But that, I think, goes with what Deirdre said about likely to be representative of numbers as well. So I just think it's really important to balance the stories out there. I know, for example, under the Armed Forces Covenant Fund Trust, we're making sure that we have good representation of projects that we're funding that support those that are less represented. So we're looking at projects that specifically support LGBT veterans and female veterans. So I just think we all need to keep it kind of in our psyche to ensure that we are being inclusive as we can in terms of the people that we're supporting, and the policies respect potentially different needs or different pathways of support for people.
Thanks, Helen. And Kate, you talked about how you are attracting more for sort of female veterans to Op Courage. Is there something about how you have advertised that, marketed it, made it seem more sort of attractive and relevant to sort of female veterans that we can learn from?
Yeah, certainly. I mean, we've taken a lot of the feedback that have come back from, our men, our women, particularly, different organisations that are there, Salute Her, Fighting Pride, Help for Heroes, Combat Stress, etc. Kind of Royal British Legion, and I think we've had a really strong voice, but also advice actually to move away from the traditional images, if you like, of the military family. And we often see, a white male gathering his child up in his hands as he comes back from his latest tour, and of course that is still essential. It doesn't mean that we're not going to still be absolutely supporting the needs of all men and women. And of course, there's an interesting report in the media today about white young men and young boys in education, for example. It is really essential that we're looking across all of this. So please don't think that isn't the case, but I think we have to be proactive at having the imagery. It's quite simplistic, I know, but the imagery of what that means for women that serve, what that means for men and women of different ethnicities and different ages as well, and different abilities and disability requirements. And I think that has actually had a really positive impact and a positive feedback. And I know that it is important that our services from the NHS do that across all of the elements. We've been talking about the vaccine at the moment and what that means for the vaccine for hesitant groups and different elements of the community at different points to do with your own physical or mental health well-being, where it might have an impact on you. If I'm talking about the menopause and what that means for me as a menopausal woman, then most of the men in this listening to this will probably switch off, but most of the women will probably switch on. So, let's really, kind of make quite sure that we do look at how those services are talking to everybody.
Thanks, Kate. That's really helpful. Deirdre, you emphasised a couple of times now the sort of the importance of having women in sort of senior decision-making roles in the services. What impact do you think is already being had by having women in senior posts now that we're starting to focus more on the kind of female sort of serving personnel and veteran experience?
Jessie, I think it I think it brings the female voice or female perspective into things. I think it's more common now for standard views to be challenged, or for there to be in a working environment other perspectives and other conversations. I think female issues in general have been championed by all sorts of people over the years, but now they're starting to filter through to the higher levels, and that's really important. I don't think we're nearly there enough, and I think you can see that when you look at, particularly in the military charity sector, where there are, you know, boards, or where there are senior executive teams which are exclusively or almost exclusively male. So I think there's a lot of work to do, but I do think it's far more common now to have at least one woman in the room, or maybe two or three, and that is starting to filter through and make a difference.
One or two women in the room is that's considered enough, isn't it? Helen, from your perspective in the Ministry of Defence, have you seen a sort of difference as you see more sort of senior women in kind of both civilian and military roles?
Yeah, it's fantastic. It's fantastic not to be in a minority in some of the meetings that I'm now at, which is certainly not how it felt 20 years ago when I first joined, but we've now got 2 stars in the RAF, in the Army, and we've had our first one nominated in the Navy, who starts position next year, and we're getting more female civil servants through as well into, you know, 2 and 3 star level, which is fantastic, and will ensure that, you know, we've got really supportive men as well, so it's not just about women bringing these issues forward. And I think it's really important actually that the research and the forums we create allow everybody to have a voice, so all people in senior leadership positions should be advocating for those who are underrepresented. But it's really important that we get the lived experience from all levels of the organisation, because I think sometimes the more senior you get, you can be a little bit protected from some of the things that come out in the research. So it's important that we provide a forum where everybody feels that they can have a voice, and then it's really important for the leaders then to advocate on their behalf.
Thank you. And there's a question here about how we get this, the kind of messages that we're both from this report and from everybody on this panel today, that, you know, we're taking the findings really seriously and wanting to put this at the heart of what government does in terms of serving the veteran community. How do we get this message out to the people, to the ex kind of service women who perhaps haven't joined local veteran associations? They don't necessarily associate with that sort of ex-serving community. How can we help them feel that they're being spoken to and listened to? Deirdre.
Sorry, Jessie, I'm just sending you a message on the chat. Could you just repeat the last line there?
No, it's fine. How do we get the message out to those ex-service women who perhaps don't associate with sort of veterans associations and haven't kind of built, you know, close ties with that community? How do they hear that we're actually keen to listen to them and want to do more to support them?
I think we have to be quite proactive, hence the reach out to the National Health Service, for example, hence the discussions that are going on at the Ministry of Defence, hence the networks that have informally been set up. But I think there's more to do to connect them in a more formal way and get those voices to the fore. And I don't think that either the Ministry of Defence for serving personnel or the charity sector should sit back and just be content with its offering. I think this is actually going to find those veterans in any kind of minority sense and to reach out to them in a proactive way rather than waiting on them coming to us. So for me, it's about engaging with those other government departments, hence the importance of the OVA, I think, but also talking to people with lived experience and saying, where are these veterans who are in need or need some support? How do we reach them? And asking for people who've actually lived the experience and saying, what's your advice? And so that, I think, is a critical factor too. Thank you.
Thank you, and thank you to everybody who has fed in questions. I'm really sorry that we haven't had time to get to all of them. I'm afraid we're out of time. A massive thanks to all of our panelists and everybody who's contributed today. I'm just going to hand back to Deirdre to close.
Jessie, thank you so much, and thank you particularly for hosting and chairing this panel session. I want to say a massive thank you to everybody on the panel, to Jessie, to Lauren, to Helen, to Emma and to Kate. And I do hope that for everybody listening and participating, that we've provided some food for thought and that everybody can mull over the report. Now, I notice that the report is being posted into the chat box, so you can access it there. You can access it from many means, and we'll send it out to participants, and there are also hard copies being produced for those of you that don't want to access it electronically. But from my perspective, thank you to everybody who's contributed, and thank you for everybody for logging on and taking part in what is a really important critical area of the military and in helping to champion women's voices both in the serving community and for our veterans. Thank you very much, everybody, and I do hope that we'll be in touch soon.